we need to have a daily goal for you, doctor. We need to have a daily goal. I cannot tell you how many times as a coach I've asked the office manager or the scheduling coordinator to say, hey, what is doctor's daily goal? And they look at me with a vacant expression in their face. They say, I don't know. Or they say, we used to have one, but we haven't talked about it recently, so I'm not sure what it is today. Well, if you don't have a daily goal, how in the world can your scheduling coordinator help schedule you to goal if there is no goal? It's impossible, right? If you don't have one, how? So as a result, what most scheduling coordinators do is simply fill in the schedule with names. That's their default technique. They just fill in the schedule with names. And that's why you can have wild swings in your production. So number one, we need a daily goal. Now, if some of you are thinking, well, I don't want my team members to think we're all about money. I'm not excited about a daily goal. I'm going to politely disagree with that thinking. I understand that we don't want to lead with our team on have everything be about money. We really want to lead from the humanistic perspective, where we want to take care of people, your patients, the way you'd like to be taken care of, clinically and behaviorally. So you want to provide the care that you would want, using the technology that you would want, using the materials that you would want as a patient. And we want to provide the experience in your office, the visit experience that you would want. Once you have that established, then it's okay to talk about the numbers. Because if we do that, the numbers will follow. Does that make sense, Naren?
Absolutely.
Where the concept of leading with an overall philosophy of truly providing exceptional care and exceptional experience with your patient, and the numbers follow. Does that make sense?
Yes, it does.
Yeah. So that's what we want to start with.
Right.
Now, so we have to have a daily goal. And you can simply do reverse engineering to figure out what your daily goal is. You figure out, how many days you're going to work this year. You break that down to the monthly basis, how many days you're going to work this month and what you need to produce every month to achieve that goal. So one of the goals we have with our consulting clients is to grow by double-digit percentage growth each year, which would mean at least 10% growth. So if you get on this train to do that, you get down this path to do this, and you want to grow at least 10% next year, you simply go through, it's an arithmetic exercise to figure out how many days am I going to work this year, and what would I need to produce for my production to be 10% more than it was last year. And then it simply becomes a new daily goal. So number one, start with a daily goal. And I would encourage you to spend some time and actually work that out. Don't just throw, the spaghetti on the wall, but come up with what actually makes sense for you.